Hello friends, I'm here today to give you a video about 3 things I think you need to know about the health profession. I'll just state up front, I have nothing against the healthcare profession or the healthcare system in Australia. I think it is amazing, and I would know I've spent a lot of time with doctors, specialists, nurses, midwives in my 30 years because I've had a variety of health concerns and health problems, and so I've seen a lot of it and it's all mostly fantastic, and I just think that there are 3 things you need to know in order to make sure that you get the best possible health outcome for yourself and for everybody involved. So the first thing I'd say is to use your voice and say as much as you can in that appointment. Your doctor or whoever you're talking to can't read your mind, and they have a limited amount of time in which to understand your symptoms and your story. Doctors these days have, they bill in like 10-minute appointments, don't they? So it's like a ridiculously short amount of time often. So you just need to give them as much detail as you can, and make sure you don't miss anything out. And don't downplay your symptoms. That's really, really important. Studies all over the US, the UK and Australia have all shown that unfortunately doctors are human, and so are other health professionals, and universally female patients who report symptoms or who report pain have their concerns dismissed far more often than male patients, and that is sad, but that is, at the moment, that is a fact in the way that the world works, and it's something that we just have to be aware of it and be watching out for it, so that if it does happen, we don't take it lying down. So use your voice. That's the first thing. The second thing I would say is to ask as many questions as you can. The Health Direct website has a marvelous tool I'll point you to called Question Builder. So you can Google that, and it literally has a list of, like 50 questions. And if you have an appointment, then you can you can prepare, sorry about the camera there, you can literally prepare by selecting in that tool all the questions that you think you might need to ask, and then that way you can print it off or you can save it to your phone, and when you get into that appointment you're not going to forget all the questions that you wanted to ask because they're all there written down, and you just have to go through them one by one and make sure you get all the information you need, because I'll tell you, you need that information. And as I said, doctors and other health professionals are only human, and they're not always going to remember to provide you each little individual piece of information you might need. So I'll give you some examples. If you are diagnosed with a condition, ask them to write down the name of it for you so that you can go home and do a bit of Googling for yourself and get an idea of whether there might be support groups available for that. Is it terribly serious? Is it lifelong, or might you get better? And definitely ask the doctor whether you're contagious. Can you pass it on to others? Is there risk management things that you should be doing in your daily life? Okay, so that's if you're diagnosed with a condition. If you're prescribed a medication, then I'm going to give you this super easy acronym to remember. It's BRAIN. Use your brain. So the B stands for benefits, benefits and effectiveness. I have to steal my sheet of notes because I can't remember. It is easy to remember, I promise. I just have a very tired brain. So benefits and effectiveness. Is it worth me taking this medication? Basically, is my life going to improve, or is it a waste of my time? R in BRAIN stands for risks or side effects. So always ask about whether your medication has any side effects, and then that leads on to A, are there alternatives? So that might be there's a less invasive test that you could take, or there might be a different brand of that medication that has fewer side effects, and that could be really useful for you. The I in BRAIN stands for intuition. So if you get a gut feel that this medication or this line of treatment is not for me, listen to that. You have intuition for a reason. And the N in BRAIN stands for negotiation, or no, or not now. So you might negotiate with your doctor, I'd be more comfortable to try this treatment on a trial basis for a month rather than 6 months, and see them again in a month and see how you're feeling. And they might say that that's perfectly fine. So negotiation, but you might also want to negotiate to not now or even no. So you're asking the question, what happens if I say, no, I don't want to take that test, or no, I don't want to take that course of treatment? That's really important to ask, because it might be that saying not now could be life-threatening, or it might be that saying not now is absolutely fine, and you might be able to put something off for like 5 years or something, and you don't know until you ask, so it's worth asking. Cool. Oh, the other awesome thing about medications, I have to tell you, I listened to a podcast the other day about how you can take medications at different times of day, and it increases or decreases their effectiveness. So, the doctor will often say, like, oh, take this with food or whatever, but what you should be asking is there a particular time of day when I should be taking this medication? So I thought that was really interesting. One of the studies they showed, showed that taking a certain cancer drug in the morning as opposed to the afternoon increased life expectancy by 3 years for patients. That's a lot of years to have with your loved ones. So yeah, it's worth asking the question, right? The third thing that I'd say is to know who can and can't do what for you. So I've got a couple of examples. Pharmacists, they can't write your prescription for you, and they can't refuse to dispense a valid prescription for you unless there's some legal reason, like they don't stock that drug because they're not allowed to for some reason. And a nurse can't refuse to ask a doctor to approve you some medication. So as an example, a sad example, but when I was in hospital recently, I asked the nurse to approve a certain medication for me because I really needed it, and she said, oh, the doctor probably won't prescribe that, and I had to really push and push to get her to go and ask the doctor, who happily prescribed it for me because I needed it. So that's sad, but that's worth knowing, and I knew that you can't say that to someone who actually needs the medication. You can't say, oh, I don't think the doctor will, so I'm not going to ask them. And the third thing is that a health professional can't treat you without your consent, except for a few limited exceptions, like a life or death emergency. They might perform life-saving surgery or something without, waking you up to ask your consent if you're under general anaesthetic, something like that. So that's sort of around who can and can't do what, and that's helpful to know, because then you might be able to say to yourself, oh, I know that my midwife can prescribe medication for me, so I don't have to waste money going to the doctor who doesn't bulk bill. So, it gives you more options. It gives you more options if you know who can and can't do what. So those are the 3 things that I think you need to know about the health profession. Comment down below with what you think everybody needs to know about the health profession. And yeah, if you think I've missed anything, let me know. Okay, talk to you guys later. Bye.